Yeah, in this episode, we'd like to discuss about what uncontrolled hypertension can cause. If a patient has an hypertension and the BP is not well controlled, it can cause a lot of things. The first one is stroke. It can cause stroke. That could be what we call hemorrhagic stroke or ischemic stroke. And insults to the brain, those blood vessels that are the tiny micro blood vessels that are inside the brain can get ruptured, and there can be occlusion to it, causing stroke. So one of the major complication of uncontrolled hypertension is stroke. The second one is heart issue. Uncontrolled hypertension can lead to cardiac issue, maybe cardiac arrest, heart attack, heart failure, congestive heart failure, and the likes. That's another thing. If someone has a long-standing uncontrolled hypertension, it can cause various or different type of heart diseases. Another one is hypertensive retinopathy. That is, it can damage the retina, the sight. If somebody has a prolonged hypertension and is not well controlled, it can damage the patient's sight or impaired the patient's sight. Another complication of a prolonged uncontrolled hypertension is neuropathy. It can damage all the nerves that are present within the body. When the pressure of blood that flows into the nerves continues for a longer period of time, it can cause neuropathy. Hypertension can cause neuropathy. Another one is damage to the kidney. An uncontrolled hypertension over a long period of time can damage the nephrons. Those are the micro units, the tiny units of the kidney. It can damage it and cause a chronic or even a bad kidney disease. Another complication of uncontrolled hypertension is men. It can reduce their potency. When a man has an uncontrolled hypertension for a very longer period of time, it can affect the patient. The patient might develop in a male, can develop what we call erectile dysfunction. The patient will not be able to have or maintain his erection. Those are some of the major complications of hypertension in male. In female too, the same thing. It can affect the menstrual cycle. It can affect all the endocrine system. That is the hormones that controls the female secondary sexual characteristics. Till the next episode, stay tuned.